There are a few takeaways that we had put out, and these takeaways actually show us that number of cases of corona infection on May 22nd, if lockdown were extended by 3 more weeks, will peak at around 1,22,000 as an average of six projections. Rate of infections begins to taper if the lockdown is extended beyond May 3rd by about 19 days to May 22nd. Without lockdown, Health Ministry has estimated that the peak could even touch something like 8 lakh cases, even by the end of April. So let me get in Sanjeev Sanyal. Sanjeev Sanyal, it's so very important at one level to have preparedness at the health level, at the hospital level, number of beds, ICUs, but at another level, it's also important for economic activity. And a lot of businesses and a lot of unorganized sector, their well-being actually depends on how we phase out our lockdown and how we actually restart the economic activity. The give and take is between extending the lockdown from 3rd of May, which is currently seen as the exit date, to about 22nd of May. Do you think the economy can take on the burden and the costs that will come in with 19 days more after May 3rd of a lockdown, as our projections show, which is the ideal time to take off this lockdown?
First of all, I'm glad you're using a structured model because it allows to a structure in the way we think about these issues. I'm not an epidemics expert, but I have spent a lifetime looking at nonlinear systems, complex systems, and financial markets and urban systems and so on. So I'm very familiar with the mathematics of it. So let me first say that such models are useful for scenario analysis. Please do not treat their projections as forecast. They are not forecast. These models are extremely susceptible to minor changes in initial assumptions. And so therefore, it is very important to treat these models, especially when you're projecting out more than a month, with many teaspoons of salt. Now, the first thing you need to take into account, because you're dealing with an extremely uncertain situation, is that we need to react to real data rather than to projections. The projections have to be continuously updated, and we certainly need to use them for getting a sense of the scale and range of possible outcomes. But what we need is really keeping track of the actual data. So here, surveillance is important. Testing has been mentioned many times. And of course, testing is very, very important. The other important thing to realize is that this thing is not scattered randomly across the country. There are clearly hotspots. The dynamics of hotspots may be completely different from non-hotspot areas. So rather than think in terms of a generalized lockdown, which we had to do initially because at that stage we didn't have enough data and things were evolving very, very rapidly, we did a general lockdown. Presumably that lockdown also did retard a generalized spread of this disease. But now that we are getting much better, finer data from the testing, and of course surveillance of deaths and other things coming in from the hospitals, we can take a much more nuanced view of the matter. So I think we need to, rather than go into this debate with this, it's better if we keep having a lockdown forever kind of approach, and have a much more nuanced approach about where are the hotspots, what are the trade-offs and risks we are taking. And by the way, we may also have to consider that we may discover a new hotspot and then have to respond to that. So I think a much more nuanced approach is what we need. As far as the economy is concerned, we have the same approach here. The lockdown was also a lockdown of the economy. But as we come out of it, we will have to begin to think of it in terms of the speed at which we undo this lockdown, and consequently what we do on the other side of it. And there are, of course, trade-offs at every stage. And our response, as you know, and I mentioned this yesterday, has also been one of step-by-step, rather than a big bang, big package in the beginning based on some projections. We have taken exactly the approach we are mentioning for the medical, which is that look at the real data, take a step-by-step, feedback-based approach and respond to this evolving situation. Do not try and base your response on one or the other forecast. Most of these forecasts did not forecast this problem.
Well,
They're not going to